So as CEO, you get involved in hiring individuals,
Yep.
building the team.
Yep.
So what are some of the characteristics you look for when you're trying to fill out a team of either people who report directly to you or further on within the organization?
Yeah, I have a list of 10 or so that are really, really essential. So part of those have to do with abilities and talents and knowledge base. Some of those simply have to do with one's character and attitude. When we're looking for an executive as a leader, we first look to see if the person knows and understands the difference between management and leadership. We want to be sure an executive is able to understand and apply the best discipline of both of those. We also look for someone that's able to apply analytic skills. You were asking earlier about changes in healthcare delivery. That's a big one that I've seen over the years. The need for some sophisticated understanding of analytics is more pronounced today than I've ever seen it before. Partly because the tools are available for us to look at problems through that lens that maybe we didn't have those tools years ago. Another reason might be because so many of the challenges, whether they're rationing challenges or otherwise, are enormously complex, and analytic tools help us wade through that and dissect those variables so we can understand them better, weigh them better, and come down to a better decision in the end. But analytic skills and disciplined decision-making in terms of focus on that deductive reasoning that comes from analytics skills is essential. Another one has to do with communication skills, because a healthcare organization is basically people. I remind, for 24 years, reminded new employees at orientation, which I attended every month, and I got lots of cards and letters from patients and family members, many, and 99% of them are a delight and honor to read. 1% is a little tough to read. But never gotten one that said, "Dear Dave, last week my life changed. I was told by my doctor that I had cancer on Tuesday. Wednesday I met my medical oncologist. My treatments began on Thursday. That radiation therapy unit you have in the cancer center is really slick. Glad we have it." Nobody's ever written me a letter like that. What I do get every day is, "I was diagnosed with cancer last week. I was frightened like I've never been frightened before. When I walked into your cancer center, I felt compassion, I felt cared for, I felt I was safe." Those are the human experiences that is all about. And that's why communication's on my short list of what we look for in executives. Because if one can't communicate, it begins with listening. It's the first and most important communication skills by my bias. That's absolutely required. Another is obviously basic, kind of goes hand in hand with communication, respect and dignity. You would think that's, everybody has that, but not so much. and lastly, in executives, we look for one to be present. One interpretation of that is to be visible, be out and about. Don't be wedded to your desk and your computer screen and so on and so forth, but be out and about, because people need not only that visible presence, but they need the support and encouragement that your presence brings. But it's a healthy list, and not everybody has it, and we're lucky if we can find it in some executives. Thankfully, over the years, we've found that at Glens Falls.